Hello everyone and welcome to our webinar, Biomedical Science, the Future of Healthcare. The webinar will be led by Programme Leader Mohammed Aleskandarany. If you have any questions throughout the presentation, please drop them in the Q&A box and we'll run through them at the end. So let's get started. First, would you like to introduce yourself, Mohammed?
Thank you, Jessica. This is my pleasure this evening to be with you in this webinar about the biomedical science, the future of the healthcare. First, my name is Dr. Mohammed Aleskandarany. I am a senior lecturer of biomedical science in the School of Science at the University of Derby. I am a medical doctor and I am a consultant histopathologist by training. So I have been through the medical school. Then I have a master's in pathology, PhD in pathology in 2011 from Nottingham University in the UK. Then I joined University of Derby to cut the story short in 2020, and I'm now with you as a program leader for the Bachelor of Science in Biomedical Science. I also teach across the program in many disciplines, but especially my specialty is pathology, where you will see me in your second year. And if you are to apply with us in the master's, you will also see me in the master's course for advanced cellular pathology. I also do research since I joined academia. This is back in 2000, the year 2000. And my main research interest is in cancer research and mainly in breast cancer. If you Google my name, you will see my research input is mainly on translational research to create more prognostic and predictive factors for breast cancer patients to be treated in the way which is tailored treatment, or what we call the precision medicines nowadays. Thank you, Jess.
Thank you, that's great. So Mohammed, what is biomedical science? Tell us a bit more about it, please.
Thank you so much. The biomedical science is a degree in science, which in our context is a bachelor degree formed mainly of 3 years of study. Every year is 2 semesters. Every semester is 3 modules. And in total, you have 17 modules, because the final year you have one module equivalent to 2 modules or 40 credit. Students can join us in a foundation year if they don't have the eligible criteria to get into the first year. And also we have the so-called sandwich course, in which the students can have a placement year after they finish their second year of study to have hands-on experience in a hospital, which we have a partnership with in the vicinity of Derby, where Derby Hospitals, Nottingham University Hospitals, Queen's Medical Center and City Hospital in Nottingham. So this is a 3-year, mainly this is a 3 years course where the students are to study the basic sciences of biomedicine, starting from physiology and anatomy, from genetics, and studying the biochemistry of the human body and how it works, moving to study of the different diseases and how they emerge, and also to study some disciplines like hematology and cancer biology, studying the cells and how our cells are functioning in an integrated way in our tissues and organs. And then move to more applicable disciplines like diagnostic molecular biology, clinical genetics, clinical biochemistry, and to get to be fully equipped with the knowledge and skills to be able to become a scientist working in the field of biomedical science, which has loads and loads of career path, which we may be talking about later in this webinar.
Super, thanks. So if we just move to the next slide, it says here that biomedical scientists are the heroes in patient care. Can you tell us a little bit more about, I guess, like say what roles they do and why they're the heroes?
It's an excellent question. As you can see in this image, these are the people who are working behind the scene. The biomedical scientists, we can call them, they are the heroes of the medical service, but they are not patient-facing. Rather than facing a patient, as you can see in people studying radiodiagnosis, for instance, or nursing, these are patient-facing specialities. Biomedical science are serving the patient, are in the medical team, but they are working behind the scene. They are working with the samples rather than working directly with the patients. But their inputs into the diagnosis and the management of each and every patient coming to seek the medical advice and medical care, whether it is in the GP setting or in the primary care setting or the secondary or even tertiary care setting, the input of a biomedical scientist into this process of medical care is huge and couldn't be underestimated. But sometimes, because people are mainly unaware of it, they may not be able to appreciate how about the great input of those people working as biomedical scientists, managing to deal with the samples with all the essential hazards associated with it, and also producing the very critical results for definitive diagnosis of the patient problem, and also will help in planning the therapies for the patient based on the diagnosis of the root cause of the medical problem the patient might have.
Great, thank you. And on the next slides, there's some stats that I remember you speaking to me last week about. Would you just tell me about the amazing 70% stat?
Yes, excellent. This is what we all see in the medical care field, where we start by having a complaint. Any one of us may have a complaint, then they are to seek the medical advice through the GP, or if it is an urgent medical problem, we will go to the A&E in the local hospitals. And in this case, we have to be diagnosed with what's wrong with us, because that's why we are complaining. In this case, the facilities of analytical service is providing what we call a 24/7 analytical service. And to this 70%, it's actually 70 to 80%. 70 to 80% of patients require analytical tests to aid in their diagnosis. So in a very practical term, 3 out of every 4 patients, or 4 out of every 5 patients, should have their samples in the hands of a biomedical scientist in a lab, in the analytical laboratory elsewhere where the patient is seeking medical advice or medical care. So suppose I'm complaining of I am having diabetes, and having my diabetes not well controlled, then I have to seek the medical advice from my GP, who may maybe refer me to the consultant endocrinologist. And all these, the GP as well as the will ask for specific analytical measures to be taken before they can decide on the proper management of me, or to modify the dosage I am taking from of my anti-diabetic medications, or even to do more and more investigations based on the results they see in my analytical results, the hematology, as well as the clinical biochemistry, as well as my blood sugar level, and so on and so forth. So the importance of this, even if the analysis or the test came out to be normal finding, this is great, because in this case you are ruling out the presence of potential diseases, and you will point for further investigations, and even it will reassure the patient. If the results are not normal, or they point out to having some medical problem, this will definitely guide the diagnosis and then the management of the patients based on what we call definitive diagnosis, because the treatment of a disease is not just treating the symptoms, it is treating the root cause of the problem, which you have to solve to see what is it through these kind of investigations, which are mainly analytical tests done by the biomedical scientist, as we mentioned, behind the scene, as we mentioned earlier.
Great, thank you, Mohammed.
Thank you.
I know we just covered, biomedical science and what it's got to do with healthcare. But can you give us a bit of information on what roles people can go on to in the careers that biomedical science could lead you to, if we just go on to the next slide?
Yes, this is as you can see in this nice slide, this is a laboratory and a biomedical science contribution to the analytical service. This is how the analytical laboratory is divided, because we have multiple disciplines in NHS laboratory, or even in the private setting, where you will find the different laboratories dealing with different samples. So the top one is the core laboratory, which is 70% of volume of the workflow in a biomedical setting in NHS laboratory. You see the clinical biochemistry, hematology, which is blood diseases, immunology, and coagulation defects. You see the next one is 15% of the volume is microbiology, dealing with blood samples and urine cultures, serology. This is in the setting when we are having the doubt or the suspicion of presence of infection, whatever it is, viral, bacterial, or fungal infection. Then we have the histopathology and cytology, which is my specialty, where we have a biopsy of tissue. This is a specimen here, or the sample is a tissue from the patient, or cells taken by a kind of a swab or by aspirations, or a swab-like cervical screening. We have the national screening program in the UK, which covers women from the age of 24 to 64. Very nice program to detect any changes in the cytology or the cells of the lining of the cervix, to be able to detect cervical cancer very early and before it become incurable. Also, we have the transfusional science services, which is very important for patients pre-op, post-op, and patients will having the transplantation. They will need this before they go into this. So this is the disciplines within the biomedical science lab in NHS hospital or even a private facility providing the healthcare setting. If you go to the next slide, please. This is where you can see also there is a great advancement in this specialty of pathology. As you can see, this is a joint statement published in 2017 by the Royal College of Pathologists as well as the Institute of Biomedical Scientists. Just remember this name of this institute, because this is the institute who is accrediting our degree here in Derby. This is one of the biggest advantage of studying with us. This IBMS, you can see their logo here on the top. They have a joint statement with the Royal College of Pathologists to enroll the biomedical scientist in the process of reporting the specimens along with the medically qualified pathologist. This is a very important leap in the career of any biomedical scientist, when they can upscale themselves to become a consultant in reporting specimens. It's 20 years ago now since the biomedical scientists are reporting on some very specific specimens like cervical screening, some specimens from the eye or ophthalmic lesions, as you can see in this background text from this joint statement. But the Royal College is pushing now to include or to train the biomedical scientists in a structured training program to be able to report even more samples and more specimens along with the medically qualified, you see at the bottom here, along the medically qualified doctors, to be able to report on the samples and to again serve more and more in the process of tailored patient management based on the definitive diagnosis on the tissue samples. This is if a student graduated with us with a degree of biomedical scientist, they will end up having their portfolio with the IBMS, and when they are in the hospital, they can enroll into this program to be able to dissect these specimens and also to report on this, working alongside the medically qualified doctors who have their degree in medicine and also at least 5 years in training. Now the biomedical scientists can work alongside these people, especially after they finish their training program, and be able to do this important input into the patient diagnosis and the medical service. Yes, you just asked about the career options. So we have emphasized a lot on the career in the NHS biomedical scientist. This we explained this a lot. You work behind the scene, you work with the patient sample in the NHS or even in the private sector, which is taking more contributions now in provision of the medical care. But very importantly, you have loads and loads of career options if you graduate with a degree in biomedical science. First, in the graduate entry medicine, you can study graduate entry. You can enroll yourself into the medical school to study medicine. And I will show you when we go forward, I'll show some success stories of our students who are now enrolled into the schools of medicine around, one in Nottingham, one in Leicester, and also in Coventry. You can be a lecturer to join university to become a lecturer and then associate professor, and then you become a professor. You can be a performance counseling. You can work as a drug discovery scientist in the laboratories of research or in pharmaceutical research industry. You can be a research scientist working in alongside the academics in different research institutes. You can work as a diagnostic radiographer. You can be a healthcare specialist and pharmaceutical researcher. You can work in food technology. You can have the postgraduate progression, which is very important. You can study master's, PhD, and also upscale yourself into the academia side of things. And these are huge routes and many options for the graduates from the biomedical science degree to choose according to their aspirations and their inclinations. What do they really prefer? To work on research with the exciting media of creating novel stuff and publish your work, present them in a conference, or even write scientific books, or to work behind the scene and to present the very important input to diagnose patients, or to be an inventor in terms of research and in the pharmaceutical companies to discover for more drugs for many medications of different diseases we need. Whatever you can do it. And by the way, during your course with us in the degree, we have the guidance, we have the tutors who will help you also identify your potential and maybe maximize your input to choose the best career plan for yourself.
Amazing, thank you.
Thank you.
And did you mention that you've got some student career success stories on the next slide?
Yes, we have. Yes, this is just a sample of what we have as students who are with us since long now. Many of them are graduated. You can see from on the top 4 images, we have Priya Sharma, just finished her PhD. I was her internal examiner. The viva occurred in April this year, and she successfully graduated with PhD. Her graduation will be in July this summer. She is with us since she has been an undergraduate student in the biomedical science in Derby. We have also Ludo. He is a PhD in molecular biology in Coventry University. He finished his PhD already, and he is now a lecturer in the University of Coventry. We have Rebecca studying medicine in Nottingham University. She is graduating this year in this summer. And we have Angie, a PhD in biomedical science, University of Derby as well. And you can see in the bottom image, you can see 5 of our students with the previous head of division as well as the previous program leader, Dr. Shiva and Dr. Vadivel, with our 5 students who have been accepted in the year placement in NHS hospitals. They did their placement successfully in Royal Derby Hospital, in Nottingham City Hospital, as well as Queen's Medical Centre in Nottingham. They have hands-on practice for a full year after they finished their second year, and they finished this. They are graduating this year, by the way. They are graduating in July with what we call a Bachelor of Science in Biomedical Science with industrial placement year. This is a major advantage if the students is to choose this sandwich program to graduate with this kind of placement. They will have a full year of practice working in the real world of a laboratory in NHS setting, which makes their applications to any further job very outstanding, as much as you can imagine.
That's great, thank you.
Thank you.
So why should students come to Derby rather than anywhere else?
Thank you so much. So if you see these stats, which are very recently released, you can see the dates of these stats are the University Guide 2025, 2024, 2024. University of Derby is in the top 15 for student satisfaction, and this is important. And these statistics is done by the students. We have no intervention in these statistics. The students are in their final year of study. They are sent a unique link by the surveyors, and they have their input into specific domains of this survey. And this survey is collected on a nationwide scale for all the universities providing the undergrad studies. And they publish these results, as you can see, top 15 in student satisfaction, top 15 in student with feedback, and top 25 in learning resources. So these are very important because a student, when they enroll into a degree, they have to ensure that before they enroll that they will receive the best pedagogical service, the best assessment guidance, as well as the best feedback on their assessment, as well as the best resources for their learning. Because if it's not just the student who will sit in a lecture theater or a hall and is watching or whatever is there as a lecture or a practical. It is a complete life of having the knowledge and the skills. And having the knowledge and the skill is not an easy task, and it must be provided by institutions which have this high reputations, if you would say, reputation in giving this good support in the students, good satisfaction for the students, as well as the best quality learning resources, as well as the academics who are delivering the modules and bringing their expertise in terms of research. All our academics teaching in this program are research active. And if you go to program page and look at our colleagues who are delivering modules in this program, all of them are research active, working in different disciplines of research, many of them working in diabetes, working in Alzheimer or dementia, in cancer studies, working in development of novel drugs and medications for different diseases, the nanotechnology, spanning microbiology, spanning the different specialties, and they definitely bring their own expertise of research-informed teaching into their teaching, which is very important for the students to be equipped with this cutting-edge knowledge and how the evidence is created in the medical and biomedical practice. Is not just reading a book or attending a lecture. It is a whole life of experience which the student has to seek and to ensure that I will receive the best quality teaching, best quality practical experience, also best quality of learning resources available on the tips of my finger, and also I will be satisfied with this as per the previous students enrolled into this course have put their input into this.
Amazing, thank you. This leads on to the next slide. So the new facility that will provide students with some hands-on experience. So if you could tell us a bit more about the Bioscience Super Lab, please.
Yes, thank you. This is in addition to the placement I mentioned before, the year placement in Biomedical Science Lab, as well as in any pharmaceutical, because we offer this as a partnership with the hospitals, but still the students can apply for their placement on different settings as well. But the Super Lab is one of the major leaps in the University of Derby, and this is what we call this a Biomedical Science Lab, which is helping, is a teaching lab as well as another super lab in research. These are two labs, not only one lab, and the students for the teaching research teaching super lab will do their practical sitting in this massive facility, which will accommodate 200 students at the same time. And to ensure that we have the best quality of practical experience, this lab is divided into different zones. Each zone is controlled in an audio-visual, very high-tech platform, which will ensure that students in each zone can work independently without being distracted by any students working on zone B. For instance, you have zone A, B, C, and D. Each zone can accommodate a cohort of students working independently, simultaneously, without being distracted by other students. So in this case, you will accommodate large number of cohort at the same time. You will not have to run, for instance, the labs at out of our sitting. You will not have the overcrowdedness you can see in the usual lab space, and also the support given by the technicians as well as the academics is very important, because you couldn't run this massive facility without the important input from the technicians as well as the academics to give the due support for the students while performing their experiments. This is an important. This will open officially mid-August, so now we are nearly 6 weeks ahead of official opening of the Super Lab as well as the Research Lab. Research Lab will allow the students to do their independent study research, which is a final year research project. Within this, also cutting-edge facility with interdisciplinary researchers are there to offer their expertise in the research methodology, analysis of the data, and even publishing this data. This is a major leap, I will tell, which we have in the biomedical science program, which will help students a lot in getting the hands-on training and hands-on experience in a very structured and organized way.
Amazing, thank you. That
Thank
leads
you.
nicely on to do you offer any hands-on learning like placements throughout the course?
Yes, thank you very much. As I mentioned, there is a 1 year placement, which is an optional to be taken by the students. And also we have the mandatory 30 hours, 30 hour, we call it micro placement. Students, when they are in the second and third year, they are asked to apply for the micro placement, which must be something which is very relevant to biomedical science. We also offer this in a wider scale in our facilities by our academics. But students also still have the option to apply for this 30-hour of hands-on practical training in the nearby facilities, in the pharmaceuticals, in pharmacists, as well as in other laboratories elsewhere in the city, as well as in the hospitals in here and maybe in their own residency area. This is 130-hour, which we help a lot in this by our tutors, as well as the Career and Employability Service. We have a dedicated team will help the students to dissect the way in finding the most appropriate placement site for this 30 hours. But for each and every module, this is very important, with hands-on practical teaching and skills. Each and every module has embedded skills which are employability skills. Within each module, you have practical teaching from 3 to 5 sessions. So out of 12 weeks of teaching for each semester, you have 3 to 5 weeks of practical teaching. This is as major part of our degree, which is accredited by the IBMS. This is a major requirement for the benchmark criteria for the IBMS, our accreditor, to include this big contribution of the practical teaching in each and every module. This is number one. Number two, the employability skills embedded in these modules is very essential, and it must be fulfilled in each and every module. And we have the so-called program employability map, where we embed the specific employability skills, like the discipline-related skills, which is related to biomedical science, as well as the soft skills, as well as the transferable skills. All these are embedded from when the student join us till the students graduate with us. We have a structured way of getting the students to get these skills on their route toward their graduation, without having to do extra effort to get this hands-on practical experience, which is essentially important for their employability later on. Because all employers, whatever the career route you as a student will choose, will look at these employability skills you already have, as well as the practical skills you already have.
Amazing, thank you.
Yeah,
if we can just go to the next slide, that just gives some contact details for the general, so inquiry teams, so the general questions, study at derby.ac.uk admissions, and I've also put Professor Ian Turner and yourself contact details there, Mohammed. So we have had a few questions that came through ahead of the session today. Am I okay just to ask those?
Yes, please. Go ahead.
So what facilities will I get to use was the first question.
Yes, as I mentioned, the facilities are ranging from the educational facilities, which are definitely the classroom and the teaching halls. You have the laboratory space, which you would use after getting the proper induction and the safety and risk assessment. You will have the library and all the resources available in the library. The Library of Derby subscribed to the major publishers, and you will be able to access full text articles as well as published books at the tips of your finger. The library also provides the so-called the offline training programs, a huge list of choice for the students to get the skills in learning, skills in scientific writing, skills in publishing their finding, skills in presenting their work at the different assessment levels. And this is a library. We have also the accommodation, which is also, but it is not in the statistics we offer, but the University of Derby is in the top 5 of the provision for the best accommodation service in terms of the students' hall. Also, we have the PAT. The PAT is person academic tutor. each student, when they join us, they will be allocated a tutor from the academics, which will be with them throughout their degree to help them navigate safely throughout the studies, as well as extracurricular. Sometimes students may have any hassle, any problem, any queries, any question, any career aspirations to discuss. The path is with them throughout the degree. This is a very important, which was not present definitely when I was studying the medicine. There is no such services. Now there is allocated path or person academic tutor having their office hours to serve the students, advise them, and inspire them to the best career options, and to resolve any problem they may be facing in any assessment, or even extra or what we call the extracurricular activities, and even life beyond the university can be discussed in this PAT sitting or PAT meeting. Also, we have the service we have, or what facilities you can have. You will have the super lab. You will have the independent study of research, which is in your final year of study with one of the dedicated researchers who are having this continued research activity. We also have some scholarships inside. We call it the OSIS, which is on-site, some kind of on-site research scholarship, which is the student can apply along with one of our academics to have 80 hours of research. Especially during the summer, they can generate some primary data, and they can be able even to publish this data in scientific journals. So very many facilities we have in the university, educational and otherwise, as well as the university life is very active in terms of being attractive and very, very nice.
Super, thank you.
Thank you.
Another question was, what can I do to assure my place at Derby?
If you get an offer, I think you need to, following this webinar, you need to do your homework to look at the program website, to look at this kind of statistics, which is published definitely in the public domain. You can see it in the university guide, and also to maybe if you have a colleague here who is studying with us, you can ask them about their own experience, which I'm sure will be a positive experience with their presence with us in the biomedical science discipline. You can even visit us if you want. We are happy to accommodate you if you want to visit and to have this friendly or informal chat with myself, or with Professor Turner, or with the admissions team, or with one of our academics. You are very welcome to come. And if you have an offer, please click accept the offer before it goes off, because in some time the offers, because we have the places in first come first served, this is important to we have a provision for a specific number of students.
Super, thank you. And the last question that we've had for the webinar this evening is, can I do a placement year between my second and third year?
Yes, sure. This is the what we call the default site or default time when the students will apply for their placement year. As I mentioned, we have two routes of placement. One of them is the NHS hospital, which we in the team have a dedicated academic. Dr. Vadivel is responsible for this. And from the end of your second year, from the beginning of your second year, you will have information about how to apply, how to write your personal statement, where to apply, and the time of applications, the time of shortlisting, and also you will be notified of the interview date. This is an important package we provide for the NHS hospital, because we work on this domain with the hospital high admin staff to ensure that we appoint the best appointable student to go to this, to represent the university in this 1 year placement. And the interview panel is made by the staff from the hospital offering the placement, as well as from us here in Derby. So this is route one for placement. The second route for placement is the route for a placement for 1 year, also in pharmaceutical industry lab, for instance, or food industry lab, which we also have a dedicated personnel who can guide the student to choose and to apply, as well as to The Career Employability Service will help in students writing their CV, writing their personal statement, all this kind of support needed for the students, because this will be the first experience for this to apply for this. So we have to offer them this important help and advice to be able to succeed or to be successful in this application process. Definitely, we are here to help in this.
Great, thank you.
Thank you.
That's all of the questions we had this evening. So I'll hand back to you, Mohammed, just to say final goodbye to everybody before we end the session.
Thank you so much for having me in this nice webinar. And any questions, as you just mentioned, Jess, we are happy to receive the questions in these emails on this screen. And we are happy also to meet the students who are interested in seeing us and chatting to us. This is our pleasure. Thank you.